we're going to talk about some new things that you've never seen before. This is about mitochondria.
Master, sir, I heard Yoda talking about midichlorians. I've been wondering, what are midichlorians?
Midichlorians are a microscopic life form that resides within all living cells.
They live inside me.
Inside your cells, yes. And we are symbionts with them.
Symbionts?
Life forms living together for mutual advantage. Without the midichlorians, life could not exist, and we would have no knowledge of the Force. They continually speak to us, telling us the will of the Force. When you learn to quiet your mind, you'll hear them speaking to you.
I don't understand.
With time and training, Annie, you will. You will.
A long time ago in a galaxy far, far away, there were intelligent microscopic life forms called midichlorians that live symbiotically inside the cells of all living things. When present in sufficient numbers, they allowed their symbiotic host to detect the pervasive energy field known as the Force. Midichlorians counts were linked to one's potential in the Force, ranging from the normal human of 2,500 per cell to the much higher levels in a Jedi. The highest known midichlorian count, over 20,000 per cell, belonged to Jedi Anakin Skywalker. Anyways, the more midichlorians you had, the more in touch you were with the Force. And it kind of actually is very similar to being in touch with your natural energy. If your mitochondria are low, you're going to be kind of sluggish emotionally and physically. So what we're doing with our research, this is opening up a whole new way of looking at how to fix somebody, how to make somebody healthy, how to recharge them. The mitochondria being the primary source of energy for all your cells, and you have 40 trillion cells. And these are the mitochondria they're talking about. These mitochondria, you have thousands in all your cell. It's the powerhouse for all your cells. They're responsible for your energy, and all drug addicts have diminished amounts of mitochondrial function and mitochondrial numbers.
I just wanted to kind of jump in and give my 2 cents on the NAD because I've kind of been like obsessed with this for 3.5 years. I'm like a full promoter of it. I've seen it do amazing things for people. I've even done it. It's pretty amazing stuff. I first got introduced to it about 3.5, 4 years ago. I went and trained with the people that kind of made it what it is in Louisiana. And I actually opened up a clinic in San Clemente, and then I met Dr. Headrick, and he was interested in doing it, and now we are where we are now. What it does is basically, like he said, when you're a drug addict, your NAD levels in your body, it's natural food for your mitochondria, right? Your mitochondria powers every cell in your body and gives you the energy to heal and recover and do all these cool things. And by using NAD in an IV bag, we're able to get a very large overflow of nutrients into your body. So basically you're saturating your brain and your body in the nutrients it needs to have an expedited recovery. You can watch somebody go through an alcohol or opiate detox without any Suboxone, without having to take a bunch of narcotic medication. You know, there's still comfort meds, but it's said to give about anywhere between 50 to 75% less withdrawal symptoms just with the IV. And I've seen it all the time. I've watched people detox off of opiates with this IV with no Suboxone. The other benefit of it is that you're expediting your brain recovery. So our big thing is we have all these treatments and therapies and groups and EMDR and all these really cool therapies that are awesome, and they probably all work very well, but people's brains are just not healthy enough to obtain and retain this information and put it to use in their everyday life yet. You're thinking of a brain that's coming off of all these years of drug use or alcoholism, and this is all great information, but my impulse center of my brain and my judgment center are just way too fried. I can't figure out how to use all this information. So what we're seeing is people that are going through this IV treatment are starting to have the lights turned on. They're starting to see clearer. They literally say things like, I feel like my vision is brightened. They start dreaming again, very vividly, which is a sign of brain recovery. They start to have reduced anxiety. They start sleeping better. They have more energy and endurance when they're working out. They start to just feel better overall.
This is a direct line to your powerhouse of your cells. Every cell in your body is going to improve too. Their eyes are bright, Their craving is, like they say, 0. They say, some of these older patients say they're 10 or 20 years younger. That's how they feel. We had one patient get the treatment, and I think she was like 60 or something, and she went back to a psychiatrist that she had seen for 15 years and hadn't seen for months. She walked in, psychiatrist said, "You got a facelift, you got plastic surgery, you didn't even tell me." No, I didn't, nobody touched me. But so it's fun to see that people look younger and brighter and more energetic and enthused about their sobriety. People don't come in here just with a brain imbalance. Their whole body has been abused and depleted and rearranged. And so this is the first time in my career of being a physician for like 35 years that you can actually give one thing to somebody and fix the whole picture at once. We're trying to turn our patients into Jedi.
Right, yeah.